Now, the best news ever is that you don't have to understand every facet of the ACA law to do this work. Okay? None of us do, right? And that's okay. You can understand enough to do this work, and then the resources is the hard part. By simply telling people that the marketplace is opening, you will be saving lives. And that's the truth. The Harvard study that came out, our Democratic County Chair, Roy Herron, speaks about it a lot, is that without expansion of Medicaid, without more people having insurance, people die. Okay? Insurance saves lives. Being able to access health care when you need it, before you need it, with preventative services, saves lives. I mean, that's just a fact. And you'll be making new friends and keeping them. How does that work? Well, you all came here and you met each other, and you're all going to need to stay in touch with each other. You're going to need to get each other's phone numbers and emails before you leave here. You're going to need to support each other, even if you're in different counties. You're going to need to talk to each other on Facebook and say, how's it going for you there? How's it going for me here? And then you're going to go out in your communities and you're going to make more friends, because you're going to tell them, I'm doing this fun. You know, I'm really enjoying myself. I'm working hard for healthcare right now, and you should come to one of our flyer drives. We've been handing flyers out. You know, a lot of people like it. They aren't cursing at us, you know. So you're going to make new friends, and you're going to keep them. Everybody likes that. Here's how you can deliver the news to everyone, and this is our plan from the County Chairs Association. First, we build lifesaver teams of volunteers, okay? And I just think that there's no better way to tell people what you're doing than by naming your right name. Okay, we're saving lives, so you're going to create a lifesaver team. You're going to learn to work together and find people who qualify. Now, how many people in this room have ever volunteered for something where they worked with a team of people before? Like all of us, right? So we got a leg up. So this is a leadership training. This is a train the trainer kind of thing. Because there's other people out there who haven't, but it's not that hard. It's not a big deal. You just have a goal, you get together, you talk about it, you figure out what your local needs are and how you're going to solve them, and then you just do it. So, and then number 3, I personally think is the hardest thing, is connecting people to local certified application counselors and navigators for enrollment. Okay? Yes, ma'am.
You need to find those two things. What's the difference between a CAC and the navigator?
Navigators are named in the federal law by name, by job description, as the people who will do outreach and enrollment assistance for people who need to get into the plan. CACs, Certified Application Counselors, were developed through the federal government, through HHS, as part of the implementation of the law. Okay? They're another level of people primarily directed at enrollment. They don't actually have the outreach component in their job description. Now, the way that's actually working, I'm not sure. Maybe other folks, maybe Becky or Mary can tell me. Navigators are paid. No, I'm not. No, I have no plans to become a navigator. I'm going to be too busy helping people figure out how to do outreach to become a navigator.
They've received special grant money.
Special grant money. And the organizations that receive the grant money are hiring the navigators. So SEEDCO is the name. SEEDCO is the name of a grant recipient nonprofit here in Tennessee that's doing that. CACs could be paid or unpaid. You could go through the modules like Jim started doing, find THCC or another organization that can manage volunteers, and you can do that on a volunteer basis. So, and number 4, the way that you deliver the news is you follow up. Follow up with the people that you meet to make sure that they get connected to enrollment services. So in this, you're going to want to keep the things that will help you. And these things are going to be available to you. I can email you files for all this stuff. This is a clipboard. I also probably borrowed this from somebody. It says, have more questions about affordable health care. I need more info. So when you're talking to someone, where would you be? You could be tabling in front of a Piggly Wiggly. You could be at a street festival. You could be at the booth that you set up every year for Fall Fest, wherever you're at. They need more information. You're allowed to get this information, their name, their email, their phone number, and their city or county, whatever your region kind of thing is. And that way you can get them. You might not even have your local resource yet, your number 3. You might not know who your CAC is yet, but you're going to be able to get them some information. So you can promise them that because you're going to follow through. The other clipboard that you might have would say, can you share the news about affordable health care? Yes, I want to help. So this is a totally different group of people. These are people who want to do what you're doing, and you are going to attract people who want to do what you're doing. And then some flyers, like the flyers I handed out. And then, where's that nifty poster? It's out front.
Yeah.
I made that poster too. So this is just how we're going to get started. How many of you have gone and done a voter registration drive? There's the nifty poster.
Did you make that?
The poster?
Yeah.
Oh, well, that's where we're going to go right now. That is from cms.gov. I downloaded the poster. I went to Fast Signs. I used to work at Fast Signs. And I had them make it for $20. Now, if people want to, the TDCCA, Tennessee Democratic County Chairs Association, could do a batch order for like 200 signs, and county parties could pitch in like maybe $20, for a set of 3 or something, and we could have them made a lot cheaper. But we have to figure out how to front that money. Okay, I'm going to go to CMS. What does CMS stand for?
Centers for Medicare and Medicaid Services.
Amen. Centers for Medicaid and Medicare Services. Right now, this fall, between October 1st, and right now especially, but between October 1st and January 1st, more people are going to start tuning into this. More and more and more people. A lot of the people that came to Mary's booth maybe a few months ago were the people who had the most urgent health care needs and had already dealt with this. So they saw what was happening and they went for that information. Other people glazed right by it. But this issue is becoming more and more predominant in everyone's minds right now. So you're going to probably be getting a wider variety of people who want to know more right now because this is coming to a head in the media. So that's good. But, oh, yeah, Paula. This is the marketplace.cms.gov website. This is your resources. There's so many resources here. And what I've done with the outreach kits that I've put together is kind of culled through them a little bit, but you may find something on here that's perfect. Like Jane was talking to me about a family that she knows that's Vietnamese. Well, where can we get, well, I don't have any Vietnamese documents in my outreach kit for you, but you'd be able to go here and find them. Okay? There's everything in Spanish and all that kind of stuff. But the place where I want to start here is there's 3 tabs: Partner with Us, Get Training, and Get Official Resources. Now, under Partner with Us, join us to become a champion for coverage. If you want to take your county party one step further, I enrolled the TDCCA as a champion for coverage. It doesn't mean that I am hosting CACs or getting CAC training. It means I have access to more email information, more resources, and I can order stuff directly from our socialistic government for free. Now, there's a lot of things that are sold out, and I just go on there and shop. I'm a shopper. So, you can just go on there and just find out what have they got. And that's how I got my my brochures about the small business program. And there's brochures like this that are coming to me about individual enrollment. There's posters. That poster there is, I'm supposed to be getting 50 of them, so order them now, because when I get them, I'll want to know who needs one. And you can, Linda, Linda's already a champion. Have you received anything yet?
Yes, I went through it early on, and some of these weren't real clear exactly what you would be getting.
Yeah.
In the text. So I got sort of a sample of things,
Mhm.
and it came in about, 8 to 10 days.
Yeah.
Right now, a lot of stuff is out of stock,
Mm-hmm.
and I haven't gone to the ones that you can just download.
Right.
But it is free, and it comes in these nice glossy print.
Very nice stuff. So if you're going to be proactive, you can go on there and become a championship of coverage, order the stuff that you think you like the best, and that lets me save, because I'm not ordering a lot at a time, because I'm trying to, kind of fly under the radar a little bit and get 500, not 5,000 of something. Plus, I don't want to waste, so if you're going to be proactive with your county party, go on there and do that, and that way I can save the resources I'm getting for county parties that need a little more assistance and organization. So that's becoming a champion for coverage. You can also get training. Is this where you got your modules from, Jim? From CMS? Yeah? Navigator training, contents of the CAC training courses, you can download those. They're not in an interactive webinar form, but they're a PDF format. You can go through that stuff. You can find out more if you need about the details. Like Jim said, it can be pretty complicated. So it might be a better thing to spend a little bit of time over here on this Get Official Resources. This is where I got a lot of the things that I've been using, the poster. So publications and articles, let's see. Like I said, it's like taking a drink from a fire hydrant, and I'm just showing you so that you can get an idea. There's bifolds, there's fact sheets, There's drop-in articles. If you send out an email for work or for your county party, let's see here. Are you ready? The health insurance marketplace is coming, and this is focused on women. So this is just very simple. Grab it, copy it, hit Control-C, you just copied it, put it in your email blast. You just pasted it in and say where you got it from. It's nice stuff. Let's see if I can go back. I can. So, multi-purpose messages, PSAs. There's a radio PSA here, and it's just a script, okay? But if you've got a friend at a local radio station that would help you get this recorded, start playing it on your local radio station, that would be awesome. That would be great. We're looking at trying to get it recorded so we can put it out to people and, send it out as a file, whatever, and then take it to your local radio station to get it done. But if you can get it done where you're at, if you've got a friend at the radio station, let me know, and it'll be finished, and I'll get it to everybody else, too. So,
Can you also give us the link to that wonderful YouTube drawing that you,
yes. You guys want that right now?
whenever?
Okay. Well, don't let me forget. So there's lots of this really good stuff. And then down here under related links, Spanish materials, American Indian, American Native, other languages. So this is where you would get Vietnamese. We have a big, in Sumner County, we have a big Laotian, or in Rutherford County, there's a big Laotian community. And in Sumner County, we have a big Somali community. So if you want to do reach into any of those groups, then you'd be able to go here and get this info. So this is CMS.gov, and I think it's a tremendous resource. I think you can get as involved as you want to with it.